If you want one way to save lives, one of the ways to do that is through blood donation. I'm here at the Kentucky Blood Center with Mandy Brajuha. Thanks for being with me, Mandy.
Great, thanks. Nice to have you out here.
Right, so I am a donor, and I've been receiving a lot more calls. There seems to be a lot more of appeals for blood donation. Is that because the supply's low, or is it just a critical need?
You know, we've been in and out of a critical need throughout the pandemic. Blood drives just aren't what they used to be, and so we are not seeing people come out. Businesses aren't back to normal. People aren't back in their offices. And so we have bordered kind of between that critical and urgent need for the last 2 years. And so it's concerning to us for the long haul. And so, you know, when we make those calls and tell you we need you, it's not a joke. Definitely the demand at the hospitals is higher than ever before.
Right, especially coming out of the pandemic. Now, for some people, they want to know where their blood's going and what it's used for. What about a lot of the blood donations, what is it used for?
Yeah, so your blood's going to stay local when you donate with Kentucky Blood Center, which is a great thing. It's helping 70 hospitals here in Kentucky. It's primarily going to things like cancer patients. Cancer patients, when they're going through treatment, need a lot of transfusions of both platelets and whole blood. In addition, there's kind of the things people think of are traumas, accidents. Somebody, hurts a limb and needs transfusions because they've lost a lot of blood. But also, I say everyday things like childbirth. Lots of women lose blood during childbirth and need a transfusion immediately after that. And so, there's a variety of different reasons. It's not always exactly what you think it might be. It's not always a disaster. It's just an everyday crisis for a family.
Yeah, certain things like anemia, and we've talked about sickle cell before.
Yeah, I mean, there's just so many everyday things where people need regular transfusions, not critically urgent, but they go in for a regular transfusion because they have a blood disorder. Maybe keeps their blood from working properly, like sickle cell, or somebody that has a clotting factor that's not working correctly and they need a different thing transfused. And so, there's lots of elderly people a lot of times will need a blood transfusion just to maintain an active life.
So it's important because it's for everyday things, not just the traumatic situations, but every day, day in and day out. And how simple is it and easy to give? Because I've given, and seems like a quick process.
I think people build it up in their minds to be so much more incredibly difficult than it is. It really is, less than an hour of your life. You come in, you register, we do a quick health screening to make sure you're well enough to donate. We want to make sure it's a good experience for you. The actual process of donating blood is 5 to 7 minutes. You've done it, I've sat there with you and chatted with you, and by the time we, have gotten through one topic, it's over. So it's really quick and easy.
Right, and if people want more information, where do they go?
Visit kybloodcenter.org or call us at 800-775-2522.
All right, well, if you're ready to take that step and help save lives, just go to kybloodcenter.org for more information. This has been Martina with Everyday Kentucky. We'll be back with more right after this.